Good evening, dear viewers, and welcome to a special Ramadan episode of Medical Talk. During the holy month of Ramadan, fasting becomes an essential part of a daily life for people living with diabetes. However, fasting raises many important questions related to health, safety, and daily balance. Changes in meal timing, long fasting hours, sleep patterns, and physical activity can all affect blood sugar levels, sometimes in unexpected ways. Many patients wonder whether they can fast safely, how to manage medication, and how to avoid complications such as hypoglycemia or fatigue. To help us understand how people with diabetes observe Ramadan more safely and confidently, we are pleased to welcome Dr. Mohammed Nu'man Njoum, Registrar in Internal Medicine. Together, we will discuss how fasting affects blood sugar control and share clear medical guidance to support a healthier Ramadan. Stay with us. I am Uthman Khalfas, and you are watching Medical Talk.
Diabetes remains one of the most widespread chronic diseases worldwide. According to the latest International Diabetes Federation data, more than 537 million adults are living with diabetes globally, with particularly high rates in the Middle East and Gulf region, where prevalence among adults may reach 15 to 20%. This makes safe fasting guidance during Ramadan especially important. During the holy month, millions of diabetic patients choose to fast. Medical research shows that without proper planning, fasting may increase the risk of low or high blood sugar and dehydration. However, studies also confirm that many patients, particularly those with stable type 2 diabetes, can fast safely with medical consultation, medication adjustment, balanced meals, and regular glucose monitoring. Ramadan is a month of spiritual balance, and with the right preparation and medical supervision, people living with diabetes can observe it more safely and confidently.
Welcome back, dear viewers, and we are talking about one of the most important topics in Ramadan, which is diabetic patients, with Dr. Mohammed Nu'man Njoum, Registrar Internal Medicine. Welcome, and we are happy to have you here in the program.
Thank you so much for inviting me to the show.
Ramadan Kareem in the beginning, and we are talking about Ramadan and diabetic patients. There are confusion regarding should they fast or should they not fast in Ramadan precisely?
Well, to be honest, this confusion was among us as doctors as well, whether to allow certain group of patients to fast or which group to be allowed not to fast. So this confusion actually, it went away when in 2020 and 2021, topmost endocrinologists around the world, IDF, International Diabetes Federation, and Islamic scholars, they sat together and they made Ramadan Diabetes Alliance. Perfect. And they came up with the guidelines. So as per those guidelines, it gave us the liberty to choose whether this patient should fast, this patient should not fast. Actually, it is based on a score. Okay. So we calculate a score when a patient, a diabetic patient comes to us before Ramadan, we calculate their score. And according to the score, if the score is less than 3, it's a very low risk, we allow them to fast. If the score is like between 3.5 to 6, it's a moderate risk. We tell them to fast, but with caution. and under supervision. But if the score is more than 6, we straight away we tell them not to fast.
What's the formula for the calculation?
It's very easy. The guidelines have made a super easy formula. We ask the patient straight away what's the age of the patient, what kind of medications they're taking, since how long they are diabetic, whether they are on insulin or not insulin, and when their sugar gets dropped, do they get to know whether their sugar is dropping. And importantly, if a female comes to us, we ask about pregnancy. Old age patient, we ask about their for complications like if they have advanced kidney disease, advanced cardiovascular disease. In this way, there are certain parameters. We calculate the score, and then we, according to that score, according to that parameter, we label the patient whether they keep or not. And there is one very important thing. That is, there are certain conditions in which even we do not need to calculate the score.
This was my question. Is there any straightaway cases that they shouldn't be allowed to be fasting?
Yes, obviously, a patient, type 1 diabetic who need insulin, who are on insulin, they come to me. If their sugar is uncontrolled, they are on insulin, we straight away tell them they cannot fast because the sugars are uncontrolled. A pregnant lady who is on insulin and their sugars are uncontrolled, we straight away tell them they cannot keep fast. An old age patient with advanced cardiovascular disease, with heart problem, liver problem, kidney problem, we straight away, because the score straight away comes 6.5. So above 6, guidelines are very crisply clear that we do not allow them.
Perfect, but it's always better to ask a doctor regarding the fasting, because we know it's a holy month. Many people will try their best to be fasting, but it's better to consult a doctor.
That is the reason we tell every patient, even in the guidelines, it's mentioned very clearly, you should visit your primary doctor at least 6 weeks before the start of Ramadan.
Perfect. So it's a long period. Maybe you can arrange something so they can fast.
Yes.
Perfect. Why we are talking about this? Because of the risk. We always try to avoid risk. What the main risk that could happen to diabetic?
The major risk is hypoglycemia, which means the low sugar level. Hyperglycemia means the high sugar level. Dehydration, fasting in Ramadan can cause, and the patient who are insulin deficient, they can end up in diabetic ketoacidosis. So these are the main risk factors, and guidelines are there actually to guide us and to educate the patient regarding these risk factors.
Yes, also we are talking about sleeping patterns. Many people try to stay late, for praying. And in the other day they have morning work or morning shift. Does sleeping patterns affect glucose or even insulin? Does it have a direct relation with this?
Definitely. Sleep does not only affect your sugar levels, it affects overall your metabolic health, which includes your blood pressure, your cholesterol. Overall, it is impacting your lifestyle as well. So in Ramadan, especially because we are having early sahurs, late iftars, and we are having praying as well. So the sleep pattern is disturbed. Actually, if the sleep is not proper, what it can do is it can raise a stress hormone, which is cortisol. Eventually, it can lead to high sugar levels. Secondly, insulin resistance. It can worsen insulin resistance actually, which is now the major cause among type 2 diabetics who are obese. And overall, a patient should try actually to have a balanced sleep during this holy month.
Is there any golden timing for sleep? We always hear about 6 to 8 hours. This is a real study?
Yep, this is actually the standard. Minimum, at least the guidelines say at least 6 hours sleep should be there, at least, uninterrupted.
And what about more than 8? It's unhealthy or it's normal? Because sometimes many people say it's 6 to 8 hours.
If you ask me, yes, for me, it is beneficial.
Perfect. Yes. So for myself, I will agree with you. What's the symptoms regarding if they feel any symptoms coming up, they should immediately break their fast?
Yes, a very good question actually. See, as we discussed the risk factors, let me explain. If a patient experiences sweating, dizziness, confusion, blurring of vision, fainting, or if the body is shaking, and if they check their sugar and the sugar level is below 70 milligram or 3.9 millimole, or if the sugar is more than 300, or that is 16 millimoles, immediately they need to break the fast. And actually there is Islamic ruling on it as well, because Islam, you know, it is a perfect religion, alhamdulillah.
Yes.
So it gives us the liberty of being healthy, to ensure the safety first. And that is the reason, you know, even while you're traveling, it is permissible not to keep the fast in month of Ramadan.
Yes.
So it is permissible to break the fast if you experience these kind of symptoms.
Because it's for a medical reason.
Yes,
and it's a real medical reason. You are not faking it.
Yeah.
Is there any way that they need to maintain or calculate during the day, in how many hours? Should they count the blood pressure, or sorry, the blood sugar in every hour, every 2 hours, or unless they feel something?
See, this is the reason I told you earlier that why it is very important for a patient to visit a doctor prior to Ramadan. This is what patient education is. So we educate patient regarding the importance of checking blood sugar levels. It should be checked at least, at least I tell my patients actually, when they wake up in Sahur, they should check at that time. They should check in Zuhur, they should check in Asr, in Maghrib, and after 2 hours after having their dinner. So it is very important to check these parameters. As I told you, even if patient experiences no symptoms and sugar level is below 70 or more than 300, they need to break the fast.
And now there is technology helping viewers,
Yes.
right? We will talk about technology more, but dear viewers, we still have more important question for Dr. Muhammad Nu'man Anjoom. But let's go for a short break and get back. Welcome back, dear viewers, and we are still talking with Dr. Muhammad regarding diabetes and diabetic patients. Dr. Muhammad, how should diabetic patient manage their medication during Ramadan, especially they are fasting?
Guidelines also tell us about medications as well. Honestly speaking, there are certain medications which needs to be changed as they increase the risk of hypoglycemia, means they can low down your sugar levels. So they need to be changed, or they need to be taken with a great caution. So medications should always be changed as per the guidance of your primary doctor.
Perfect.
So it is important to visit your doctor, because there are certain medications which you take in the morning before breakfast, but in Ramadan that medication maybe need to be shifted after iftar, or the iftar medications, they need to be reduced. In a similar way, there are types of insulin you take in morning, you take
Yes.
in evening. So there are different types, like some insulin are to be taken 5 minutes, like immediately before the meals, and 30 minutes before the meal. So they need to be adjusted.
Yes.
So that is why I again emphasize for the general public as well, that is why it's very important to visit your primary doctor, to visit your primary diabetologist, so that he can adjust your medications. An important thing which I tell actually when I was practicing back in Pakistan, I used to tell my patients in my clinic to at least keep 1 or 2 fasts before the month of Ramadan, so that the body
can adjust.
Yeah,
Mumtaz,
so in the similar way, we can practice, and many doctors should have been practicing here in Kuwait as well. So it's very important, to visit your doctor. Important.
It's more like trying to see what will happen. What's the difference between fasting and non-fasting?
Yeah.
Yes, and also we are talking about the main solution or main treatment for a diabetic, which is insulin. Usually they take it before the meal. Do they have to take it in the morning? Standard speaking.
Well, let me try to explain you in the simple words. See, the insulin, which is to be, there are types of insulin.
Yes,
So
yes.
the insulin, which is to be injected immediately before the meals, right? So in the suhoor, it is the same. You have to immediately inject before suhoor. But in iftar, you will not inject immediately before iftar. You know why? Because in iftar, you will be having only a date and water. Your main meal will be after Maghrib. So that insulin, which is to be injected immediately before the meal, it should be injected after Maghrib before dinner.
Okay.
And secondly, there are certain insulins which needs to be taken 30 minutes before meals. It is the same you take in sahur 30 minutes before sahur, but in the evening dose, you have to take it before iftar. Why? Because if you take before iftar, you have 30 minutes. You do your iftari, and it will take 30 minutes to read namaz, and then you need to have your dinner. So that 30-minute window, this insulin will help, so your sugar levels are not spiked.
Yes.
When you take your dinner.
Yep.
So I tell the viewers to listen this thing 2-3 times, then they will understand what I say.
Yes, but I mean some patients they don't have a system. Sometimes they are invited with friends. Sometimes what do you do with patient who doesn't go according to the plan?
This is the reason why we calculate the score initially I told you.
Yes.
So if the patient is low risk, his sugars are well maintained, or insulin, so it's very easy for us to guide him, and it's very easy for him or her to manage their sugar levels. So that is the reason where these calculators and guidelines play a very vital and important role.
We are also talking about fasting. Does it help long-term diabetic to organize their life and blood sugar exactly?
This is again a good question. See, fasting in month of Ramadan is separate. Fasting in other days is separate. So for Ramadan, actually, according to the guidelines, according to the risk, yes, because we already planned. So for the month of Ramadan, fasting will not affect your long-term sugar control.
Okay.
But if you ask me that, doctor, if I can fast other days as well, it becomes little difficult, because in the month of Ramadan, we already adjusted your dose. We
Yes.
adjusted your insulin dose as well. We reduced your medicines as well. Maybe we have changed your medications as well. So in other days, some days you are fasting, some days you're not fasting. So it's difficult for you
Yes.
to manage. I mean, to go on full dose on the days you're not fasting, and to go on the
Different yes.
days, different regime when you're fasting.
So in Ramadan, for because it's a 30-day, you can adjust more.
Yes.
But it will give you the same effect, right?
Yes, it will actually. Why the planning is important? Just to ease your 30 days of fasting, because it's a blessed month. Everyone wants to fast, and we don't want people not to fast. But with the experience overall, the global guidelines are there to guide us in order to safeguard the patient's health. So safety is actually important. Health is the main priority. Even in Islam, it also emphasizes on safety and health first. So that is why the guidelines are there to guide us.
Yes, and we are also talking about monitoring. Is there any difference between monitoring before fasting and after fasting? Is there a different system or a different planning for monitoring exactly?
Yeah, so if you ask me if you want to monitor your blood sugar
Yes.
levels other than the month of Ramadan, yes, actually we tell the patients, we give the target to the patient. So if it's not Ramadan, if you're not fasting, so actually we tell the patient at least to check twice. One is in the fasting, because we give the patient target that your fasting blood sugar level should be less than 130 milligram. That is less than 7.2 millimoles. And we tell the patient to check any time in the day after your main meal, like 2 hours after your main meal. And that we give the target that it should be less than 180 milligram deciliter, which is around about 10 millimoles. This is our target in general. But when we come to Ramadan, so we have to educate the patient to check the sugar, as I said earlier as well, at least at time of suhoor, at time of zuhur, at time of asr, maghrib, and 2 hours after breaking the fast. So this is where technology comes in because
Yes.
5-time pricking finger, to tell it's very easy, but to do at times it becomes a little bit difficult. But we have to do it
Yes.
because it's very important. Because you're fasting, we should not compromise on the health. So technology helps us here.
And it's easier to monitor even through the phone. Technology made it easier, more easier than before.
Yes.
But still, many people doing a lot of mistakes, common mistakes. What are the common mistakes that we are talking about, especially in Ramadan, and could risk the patient to be harming their health?
Well, the most common mistake done in Ramadan is people, they don't check their blood sugar levels. Actually, the device which is placed on an arm, it's little bit expensive. Few patients, maybe they cannot afford, and they have to check by pricking the finger.
Yes.
So people actually, they think that it might break their fast. It's not like that. It will not break the fast. So let it be clear. So the common mistake is they do not check the blood sugar levels due to fear of the fast might get broken.
Yes.
Secondly, they skip their suhoor at times. They don't take. They're not well hydrated.
Yes.
Even they don't go to their doctor. They miss their medications, or they stop their medications on their own. Or and importantly, in iftar, they don't follow the guidelines. I mean, they don't follow the proper diet plan. They overeat. So that can actually end up in having a risky
Yes.
health. Yeah.
Thank you for being with us, and we are honored to have you in our program, and hopefully all the audience got a lot of valuable advices from yourself, Dr. Mohammed.
Thank you so much, dear. Thank you so much.
Thank you.
Yeah, at the end, actually, with your platform, I would like to, advise general public that please visit your doctors prior to Ramadan. Get your risk calculated.
Yes.
What is your risk score actually? And then stay well hydrated. If your doctor allows that you can fast in the month of blessed Ramadan, so you have to stay well hydrated. You need to take your suhoor on time. In Islam, it's allowed, it permits us to take suhoor, till late.
Yes.
And iftar early.
Okay.
So make sure you do that, and you don't overeat at the time of iftar, and stay healthy.
Hopefully, this is the main purpose of this program, is to be healthy during Ramadan precisely. And we are very honored to have you. Thank you, Dr. Mohammed.
Thank you so much.
Dear viewers, we will take a short break and we will be back. Maintaining family health during Ramadan starts with balanced routines, emotional well-being, and mutual support. Encouraging healthy sleep patterns and regular medical follow-ups helps every family member stay well. A calm, supportive home environment plays a key role in physical and mental health throughout the holy month. And now, dear viewers, it's time for our family health tips. Let's watch it together.
Hi viewers, it's Fatin Ismail, clinical dietitian specialized in metabolic balancing. And Ramadan Kareem. Today's topic, we're going to be talking about a very common symptom that happens in Ramadan, headaches. The majority think headaches are related to caffeine withdrawal, in other words, because your body is used to drinking coffee in the morning. But this is not the case. During fasting hours, especially in warm weather, the body loses fluids and electrolytes. When people break their fast, they run to drink a lot of water between iftar and suhoor. And this could put a strain on your kidneys, affect your adrenal glands, and this thus could cause headaches. What to do? Should you drink a lot of water? No, that's not the case. The case is you should hydrate your body. Quality over quantity. You need to make sure that your body is actually being hydrated. How? When it's time to iftar, drink your soup, your bone broth, your vegetable broth, and make sure that in between meals you drink your electrolytes and your fluid. It could be from tea, from soup, from drinks. Most important, not to bulge up on a large amount of water. Again, as I said, most headaches don't improve when you drink caffeine. It's mostly related to your water intake. If you struggle with Ramadan headaches, fixing hydration quality, not just quantity, can significantly reduce them within days. I wish you all a happy and healthy Ramadan. Stay hydrated.
Dear viewers, staying active is an essential part of maintaining a good health, especially during Ramadan. Simple physical activities and light exercise can help improve energy levels, support blood sugar balance, and enhance overall well-being. In this report, we will explore how safe and moderate movement can benefit our health during the fasting month.
مبارك عليكم شهر. This is Coach Abdullah Mtawwa, certified and qualified personal trainer. I have more than 30 years experience in this field. So today we're going to talk about the warm-up. Warm-up is the first things you have to do before doing any sport or exercise. This will avoid injuries and muscles strains. So today we're going to talk about the warm-up, the type of warm-up, and how to do it to be safe and avoid injuries. Beginning of any exercise, we have to do a warm-up, and warm-up has two types: stationary and movement warm-up. And now we're going to start with the movement warm-up. This will be good for your shoulders and your chest as well, front and back. 10 by 10. And we have to move our hip left and right, left and right, left and right. These things, we're gonna reduce your possibility of any injuries, and it will benefit your exercise too as well. And then gonna down and up, down and up, down and up. Each exercise or warm-up exercise, you're gonna do it 10 times, not more than that and not less. So 1, 2, 3, the first exercise to warm up is to increase the body heat by running in your place. It will be for 30 seconds. And done. It will be good for your bone and joints flexibility. And it will be good for your elbows as well. especially the people who are playing paddle or tennis. After each exercise, you have to do a body cool down to reduce the injuries and to benefit your exercise as well. So we're gonna do the stretching of your body. 1, 2, 3, 4, 5, up to 10. And then we'll go up and count to 10. Then come down and utilize the other hand. 1, 2, 3, 4, up to 10. And then you're gonna be up, count to 10 as well. And then go back, and count to 10. Then come down. This exercise, we can do it 3 times. It will reduce the muscle strain in your back and hip. This will stretch your thigh, hips, and hamstrings as well. And count to 10.
Dear viewers, as we conclude today's episode, we remind our viewers that Ramadan is a time for balance between worship, daily life, and health, with the proper medical guidance, awareness, and thoughtful daily habits. With the proper medical guidance, awareness, and thoughtful daily habits, people living with diabetes can navigate Ramadan more safely and confidently. Thank you for watching Medical Talk. We wish you a healthy, safe, and blessed Ramadan.